Looking further into the Therapeutic Scraping Essentials textbook. The book begins with a table of contents, supplying the key chapter for focusing on educational material related to scraping therapy. The 8th chapter is the beginning of the illustrated guide, which demonstrates scraping therapy procedures and is divided between particular body region sections such as neck, trunk, back, upper extremity, and lower extremity. The end of the book supplies an index. The beginning of each chapter begins with a set of learning objectives that are key for the reader to focus in on while advancing through the material. At the end of each chapter will be supplied a list of references to support evidence-based practice for applying scraping therapy. Each chapter is organized concisely with clear headings and subheadings. The pages are thick and not thin and flimsy, adding to the durability of the clinical reference. The book is progressive in nature, meaning that the reader should advance from chapter 1 through chapter 7 in order to best understand fundamental concepts of therapeutic scraping. Once arriving to chapter 8, the procedure demonstration section, the reader will then be exposed to specified demonstrations for applying scraping tools for pain and injury purposes. Within the demonstration section, each section supplies its own table of contents, such as for the neck procedures, we can see listed specific anatomy terms used for indicating muscles that are commonly encountered in the physical rehab setting. The layout of each procedure is exactly the same. On the left side page supplies objective information that is related to the muscle of interest, while the right side page is the actual demonstration that supplies steps for using scraping therapy tools, pictures as illustrations, and additional tips for making for a successful treatment session. If we were to look at a specific example, we can see this muscle is the levator scapula, having proximal attachments at C1 to C4 transverse processes, with distal attachment at the scapula superior medial border. Its muscle action is involved with neck extension, side bending, and rotation, in addition to scapula elevation and downward rotation. Common clinical assessment findings related to pain with palpation on the upper scapula towards the neck, limited range of motion with cervical side bending, poor posture with elevated shoulder, activity difficulty positioning and turning the neck. In addition, for each body structure will be a description of that muscle and related injuries or syndromes. The procedure demonstration section is intended to not only supply the methodology for going about scraping therapy, but is to assist with visualizing the actual anatomical sites of the body structure involved. For example, in the levator scapula, which has proximal attachments at C1 to C4 transverse processes, the learner should be visualizing and tracing with their finger or use of their own scraping tool where those particular attachment points are to better learn and familiarize themselves with how to apply the tool, and more specifically, where to apply the tool. If we were to work through this therapeutic scraping for levator scapula, in which each step is going to correspond to a particular picture, such as step 1, picture 1, step 2, picture 2, step 3, picture 3. Step 1 begins by saying, start scraping at the superior medial border of the scapula. So with my tool, I am on the superior medial border of the scapula, and I am applying strokes upwards towards the neck. In step 2, it says to release on the lateral side of the neck for accessing levator scapula's attachments along the cervical transverse processes. Step 3 states to continue through the neck to the back of the head to clear proximal attachments at the upper cervical transverse processes 1 through 4. The tips suggested are stated as such. Scrape levator scapula in side line. So therefore, each section typically gives the learner an idea of how best to set up the recipient for successfully accessing the anatomy of topic. If indicated, the provider will palpate and detect a distinct trigger point on the superior medial border of the scapula. Superior medial border of the scapula, along with restrictions through the levator scapula leading up into the neck. After scraping, the provider applies scapular depression to stretch the muscle. Generally, most of the tips will indicate an appropriate aftercare stretch that can be applied by the therapist or provider. Moving forward, each body structure follows along the same format, with objective information on the left and the actual scraping procedure on the right, with illustrations corresponding to the steps. There are 50 illustrations, or actually there are 50 body structure case scenarios, but each scenario has several illustrations, making for actually hundreds of illustrations throughout the entire textbook. Let's take a look at iliotibial band, which is on page 236. Here we are. Okay, so same layout. On the left side, we have the anatomy, the muscle action, assessment findings, and description of the body structure with any related syndromes or injuries. And on the right side, we have the therapeutic scraping procedure, listing steps of how to apply the scraping tools, with each step corresponding to its own picture. 3 to 3, 4 to 4. Followed by a brief set of tips for setting up the recipient to best access the body structure of treatment, in addition to any guidelines for aftercare stretches. If we were to work through this particular structure, we have iliotibial band having anatomy sites, proximal attachments, ilium at the iliac crest, the gluteus maximus, the tensor fascia latae. The distal attachment is on the tibia at the lateral condyle at Gerdy's tubercle. The muscle action: assist in hip flexion, abduction, and rotation. Assist with knee flexion and stability. Assessment findings include pain with palpation at outer hip, thigh, and knee, limited hip adduction flexibility, which is commonly referred to as Ober's or Ober's test or Ober's sign. And there is generally muscle weakness with hip abduction. Some activity difficulty will be found with standing, running, and cycling. And those are just guidelines. There can be numerous activity limitations. This has a rather long description for IT band and related syndromes, probably because it is so common and it has many common attachment points that there's more to discuss about that there. Going to the therapeutic scraping procedure itself, the idea once again is that the learner will be using the anatomy sites to visualize where they are applying scraping therapy. So as a review, proximal attachments are at the ilium, iliac crest, the gluteus maximus, and the TFL. If we start working through the scraping therapy steps, begin scraping along the iliac crest. Then direct strokes to clear sites connecting to gluteus maximus and TFL. Continue strokes at the outer thigh on step 2. Step 2, continuing strokes on the outer thigh while blending with the quadriceps anteriorly and the biceps femoris posteriorly. Apply scraping in step 3 now. Apply scraping at the lateral aspect of the knee here, where IT band becomes narrower approaching the patella. Step 4 says finish scraping at IT band's distal insertion on the Gerdy's tubercle of the tibia. And we can see Gerdy's tubercle with its own therapeutic scraping mark, specifically on Gerdy's tubercle. So the anatomy reference is entirely correct and applicable. The tips say, position for scraping in side-lying hip adduction with the leg hanging off the table. After scraping, the provider facilitates IT band stretch by pushing the leg down towards the floor for added hip adduction, which is commonly referred to as the Ober's stretch for the IT band. Again, there are 50 cases as such to learn therapeutic scraping. The end of the book supplies a complete index. It is full of terms that are cross-referenced throughout the manual, such as anatomy terms, such as injury terms, fundamental words towards the scientific rationale and mechanisms and other portions of chapters that preceded the demonstration section. For example, fibroblast, design and function of fibroblast, inflammation, so on and so forth. So let's say if we were looking at iliotibial band, for example, I could go to the index and find that iliotibial band is on 236. I could also look up ilium in and of itself. Additionally, to make it easy for learners who are not completely familiar with anatomy yet, there are general references supplied within the index. For example, if the learner did not know specifically that the lateral muscle at the thigh was IT band, they could search for thigh pain lateral, and it would land them at 236, which is the IT band. And it does the same for anterior, medial, posterior, and it does the same for throughout the body, such as the arm, lateral arm, or ankle. Therapeutic Scraping Essentials, IASTM and guasha in Health and Therapy, an illustrated guide on treating pain and injuries for rehab professionals.